back to Breaking Through. Thanks for listening. We have a show today where we cover what is happening with the backlash against feminism, with the Epstein situation, and more. After that, we dive into protecting our care, why healthcare is being ripped away from people, and what you can do about it. Following that segment, we touch base with calling up justice about the importance of disability rights and how we all do better when we're all doing better. And we close the show talking about the legislative timeline. It might sound a little bit wonky, but it's actually not, because there's a lot coming up where we need to raise our voices and we need to get ready to rise. Thanks so much for tuning in. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We are joined right now by an amazing, spectacular nation-lifting guest, Nicole Regalado of Ultraviolet. Welcome, Nicole. Woo!
Thank you. I'm so happy to be here.
I'm really excited that you're here because there is a lot going on. There is a lot of attacks happening against women, against people of color, against families, against children. I can't even believe it. And Ultraviolet has been rising to protect and advance people across America so that everyone actually has a chance to thrive. So I'm wondering if you can share with our listeners what's happening. What are the top priorities at Ultraviolet?
Yeah, thanks, Kristen. So Ultraviolet is a national women-led gender justice organization. And for more than a decade, we've leveraged technology and people power to advance feminist cultural and political change. So here's our read of the moment we're living in right now. We are 100% living in a backlash moment to feminism and the Me Too movement. We're seeing that materialize in a number of executive orders and even the cultural zeitgeist, where so many survivor stories are being left out of high profile cases that have been brought against people like Sean Diddy Combs, et cetera, et cetera. And what we're doing at Ultraviolet is we're fighting back. And exactly how that's happening is, look, the administration is gutting our civil rights and liberties using diversity, equity, and inclusion as a Trojan horse. It's really not about DEI. It's about taking people of color, taking women out of the public sphere. That's materialized in things like deep cuts to research on breast cancer. It's in executive orders that have encouraged banks to stop enforcing policies that prevent gender discrimination in lending. And so many more other things, right? And then finally, we're also making sure that even though we have a sexual predator who has been found liable for sexual abuse in the White House, we have a cabinet full of people who have either been accused of or actually charged with some sort of sexual misconduct. We are making sure that even though we are living in this toxic environment, the survivors of gender-based violence are still a part of the narrative, that we are still seeking justice for them, that we're still lifting them up. And so much so, this week alone, the past couple of weeks, when the news has been dominated with, the Epstein files and Trump's undeniable connection to the late pedophile. So those are the two things that we've been focusing on, and I'm so happy to talk more in detail if you want to know more.
I want to know more. I want to talk about more. I love talking about this topic. And I want to look a little bit closer at the backlash and why it's backlash. And one of the things you started out saying is that we're having a backlash against feminism. And listeners in the audience may or may not know that I wrote a book called The F Word, Feminism in Jeopardy, Women, Politics in the Future, several decades ago when we were in another situation of backlash. And so backlashes come and hopefully go. Hello, hopefully go. And I have had a lot of questions though. What is feminism? And I've had that over the years. I've had that from my kids. Mom, what's the F word? Is it the thing I saw written on the slide at school? No. People saying, what's the F word? Is it equality of all genders? Yes. So I want to give the dictionary definition of feminism, because I think that's really important, because when we're in these moments of extreme backlash, all of a sudden people are using the same word to mean entirely different things. And that's happening right now when we're talking about feminism. So the dictionary definition of feminism is the political, economic and social equality of people of all genders. It is not saying one gender smushes another gender. It is saying the equality of all genders. And I just think that's so important because there's so much misinformation, disinformation, and harm that gets put out during a time of backlash. And some of that, as you mentioned, is going on around this Epstein situation, which is just awful. I mean, can we say just awful? I myself was reading the New York Times yesterday, and I learned even more awfulnesses that was proven to be happening due to primary sources. So this is not misinformation or disinformation. This is primary sourced awfulness. And we see time and time again that Donald Trump was actually part of that awfulness. And some of that came out when he ran for election the first time. So part of me is like, whoa, I'm surprised. Why are people surprised about this? Why are people pretending they're surprised now? But actually, it is worse than we thought. So I'm wondering if you could share a little bit about what it means in terms of the mix of disinformation and misinformation in a time of backlash when we have the President of the United States in the mix as somebody who is really anti-equality, anti-equity, anti-people being able to build good lives.
Just keeping track of all this news and kind of all of the news of the past couple of weeks is like, we wouldn't have to see the Epstein files if we as a nation actually believe survivors. Survivors are a primary source. And survivors who were girls at the time of their abuse, there were teenage girls, have been sounding the alarm on Epstein and his pedophile friends for decades. So, you know, it's infuriating to me, right, that we're now in this moment where all of this is now news, but at the same time, you know, we're at a pinnacle now that we are winning kind of the public narrative in terms of demanding transparency, demanding clarity into exactly what happened with Epstein and his network of friends. So, you know, the one thing I'll say is that Trump, there's definitely a pattern here. We're seeing it when Musk and Trump were kind of having their spat on Twitter. Musk dropped a bombshell about Trump being named in the Epstein files. A few days later, Trump bombs Iran. We're seeing another bombshell, right? The Wall Street Journal drops news about a birthday card that Trump gave to Epstein. And then Trump tries to distract us with a news story about his chronic nerve condition, right? And so we're seeing that this is really making Trump uncomfortable. And us as survivors and survivors advocates at Ultraviolet are, you know, really want to ask the question of like, who is he protecting? What is he hiding? What is the administration hiding? It was absolutely disgusting that Trump and Pam Bondi used the pain of survivors to gain political points with their base, promising that they would release the Epstein files, promising that they would bring these predators to justice, and then, you know, completely doing a 180 and in fact refusing to acknowledge that the files even exist. You know, that's not just a slap in the face to survivors, but that's also costing them quite a bit of supporters, of MAGA supporters who are now completely infuriated that they were lied to. And again, this is a part of the backlash. This is a part of you know, living in a world where mis and disinformation is running rampant. At Ultraviolet, we run the Women's Disinformation Defense Project Coalition. A lot of the disinformation and misinformation that we're seeing are things like, you know, undermining the stories and the experiences of survivors. We're also seeing young women being targeted with dis and misinformation about feminism, about what feminism is, right? And so this is a big problem. And a lot of this dis and misinformation is being supercharged online with social media, with websites, with targeted search ads. And we at Ultraviolet are doing all we can to intercept people who are being exposed to this mis and disinformation and then presenting them with facts. And that's become increasingly difficult. But as a coalition, we're doing this all together. And we're hoping to really shape young women's minds to make sure that they understand that, the true meaning of feminism, the true meaning of gender equality, that feminism is still a majoritarian issue.
Yep.
That DEI is still wildly popular, especially among women. 62% of women support DEI programs. So
Mhm.
all of this is fact being completely distorted by this ecosystem that Trump and his MAGA supporters have created online. And yeah, it's going to take all of us to make sure that it stops and we get out of this backlash moment.
Yeah, for sure. And when we're in the backlash moment, as you said, what we're seeing is a lot of chaos production by Donald Trump and
Yes.
the people who support Donald Trump, so that it makes it incredibly difficult to follow the bouncing ball to see the actual facts. And one of the things in the New York Times that came out recently is that they were suggesting an important question that I hadn't thought about is, how did Mr. Epstein make his money, and how did he finance his sex trafficking, which he and his partner were convicted of over the 2 decades? At his death, he had $600 million. And also, they found that at least one of his bank accounts had 4,725 wire transfers, adding up to $1.1 billion. So the question that many US senators have asked, and that many of us are now asking, is, who is financing that? Where did that money come from? What is happening? And those files presumably should have some of that information about where the money came from. And so I loved when you brought up that instead of following the actual data, the objective data about where did the money come from, what's happening, who is involved, who is paying, how much, we're over here talking about, random stuff that Donald Trump thinks about on the third Tuesday of each week, or, once a day. He thinks of something totally random and makes a random, accusation, as you noted, a random bombing, some type of random, like, we're like, what? So to people who are listening, we're in this climate that is pretty unique. Some people are calling it an attention economy. In this attention economy, where we see people like Donald Trump getting attention, negative or positive, and that is, increasing his overall presence in a non-negative way. What should people do? What tips do you have? How should we break through the disinformation? How should we fight the backlash in this pretty historic moment in history?
Thank you. Yeah, I mean, this is a moment where our critical thinking skills are going to be so important. We need to be doing things like checking our sources. Google rolled out AI summaries for Google search. I encourage people not to just take that at face value. Make sure that what you're Googling, what you're searching for is actually backed up by credible sources, by academic institutions, from trusted institutions that do, popular research with polling and things like that. And we need to be really careful. We need to be careful that we are double checking our facts. And on top of that, the news is so overwhelming. It just, there's so much coming at us all the time. And for folks who are like, just like me, who care so much about fellow human beings, I highly encourage folks to pick an issue that you care about the most and do what you can to fight back and to protect our rights and civil liberties. It's hard to do everything at once, and we really need to focus as human beings and also be very, very aware that shortcuts in technology are sometimes not what we want. They're convenient. AI summaries are convenient, but they can also sometimes be inaccurate. So double check your sources.
Thank you. We have 27 seconds left. How can people get involved, stay involved, and support Ultraviolet?
Thanks so much. So we are actually flying an airplane banner over the federal prison where Ghislaine Maxwell is being held in Tallahassee tomorrow. It's a stunt, and we're hoping to just keep this pressure on, to keep this undeniable connection between Epstein and Trump in the news. And the banner will say Bondi and Trump are protecting predators, because they are. So keep a lookout for that. And you can always visit our website and social media platforms. We are on Instagram, Facebook, TikTok, all of it except for X. And you can keep up to date on our work there. So thank you so much.
Thank you so much. Thanks for being on. Thanks for all you do. We're going to take a quick break, but stick around. We'll be right back with our next guest talking about protecting our healthcare, what happened and what you can do about it. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We are joined by two outstanding, fabulous guests, Joy Chaney and Vaishu Jawahar. And what's exciting is both are from Protect Our Care, and we have not needed protection of our care more than ever than we need right now. And that was complicated, I know, but basically everybody gets sick. Everybody should get a chance to get better. And right now, Republicans and Donald Trump are pulling away healthcare access from people across the country in super bad ways that hurt our economy and our families alike. So as we welcome and open this segment, I want to ask Joy first, what are the most compellingly awful things that are happening to our healthcare policy right now that everybody should know?
Well, Vaishu's going to get into details, but basically what everyone should know is the big, beautiful bill, frankly, that's not beautiful, is an ugly bill. But I want you to know what it is by reference. Is going to cut health care for millions of Americans. About 15 million are going to see their health care cut, a combination of, being priced out through failure to extend tax cuts, and the thing that everyone knows about 10 million who are going to get cut off Medicaid rolls, right? So whatever version of Medicaid you have in your state, it may be called something different, but it's Medicaid. And look, the word has been that, these cuts are going to happen in a couple of years. Not so. In some places, those cuts are already going to begin. And certainly, if you are in the private marketplace, you're going to see premiums increase. Some of those premium announcements are happening this fall. Then, of course, there's cuts to SNAP benefits. There's cuts to obviously the Planned Parenthood funding, which means lots of Planned Parenthoods, hundreds of them are at risk of closure. And then I would say the last piece is when you cut Medicaid, you are also cutting funding to rural hospitals. And do not believe what they're saying, we came up with some fund to help rural hospitals. Those rural hospitals haven't found out. Many of them are beginning to consider closing. And if not closing, cutting off some of their services, and one of those services would be around maternal health centers and birthing centers. So that's a real problem for women, and this is Moms Rising. We want moms to be able to have the care that they need, and that's at risk.
100%. And people know that we already have a maternal health crisis in America. We are the only country that is an industrialized nation where maternal morbidity is going up. More women are dying in childbirth than ever before. And we have a tragic situation where Black women are dying in childbirth 3 times as often as white women. And so we have an emergency crisis. And instead of addressing the maternal health emergency in America, Republicans actually pulled back the very programs that were kind of helping to hold together access to healthcare that we have now. So they're making it worse, people. It's making it worse. Vaishu, you have a lot of details. In the specifics, what can people be expecting?
Yeah, so I think the top lines of this bill are that Republicans are really creating a healthcare emergency across the country, all to give tax breaks to billionaires and people who own yachts, big corporations. And in order to do this, they're ripping away coverage from 15 million people. Over the next 10 years, 15 million people across America are going to lose their health care because of this bill. They're going to raise premiums on about 20 million people more, other costs on millions more, and they're going to be closing rural hospitals. Over 330 rural hospitals are expected to close because of this bill. Over 500 nursing homes are expected to close because of this bill. And also, as Joy said, hundreds of Planned Parenthood health centers across our nation that provide critical, essential, life-saving care to women are also thrown into risk. And again, they don't need to do this. This is all to give tax breaks to billionaires and corporations that are already flush with money. They're giving these tax breaks to people who don't need it. And it's sad that they're doing it on the backs of the moms and many working families who rely on Medicaid.
And Joy, we have won sometimes against all odds in moments when we needed to rise up and protect healthcare. This vote was very close. We had to have the vice president come in and be a tiebreaker, and it was just a squeaker of a vote in the House. What should people be doing to help actually reverse the policy that just happened and to protect our care moving forward?
Okay, so you're right. This was very close. And look, sometimes, loss is a loss, right? It's a little bit of a zero-sum game. But when you're this close and the bill is this unpopular, you need to hone in on it. You can't just walk away and begin to accommodate for it. And you can do those things, but you also got to hold the members who voted for the bill. You got to let them know, because there are still opportunities to either one, just flat out reverse the healthcare provisions of this bill. That's on the table. I believe we're gonna see some bills to that effect, but also to mitigate, right? But in order to do that, you have to create the conditions for it. This bill was more popular, and then people learned about it. It became so unpopular that Republicans walked away. We have a whole member of the Senate Republican caucus who's resigning. Not resigning. He's not running again because of the unpopularity of this bill, where the vice president had to come in and break the tie. That only happened because we held them accountable. We have to create the environment and the conditions, which means while they are at home, you all of your listeners, hopefully Moms Rising, etc., you all should be holding town halls, asking those members to come. You should be attending any meeting on any topic that they are holding. You need to be showing up, and you need to be talking about how this bill, this big ugly bill, is going to impact your life, the life of other people in your communities. You have to do that. You have to hold them accountable. So I think apathy is what they're counting on. Anger, fear, frustration, atrophy, right, is what they're counting on. And you cannot do that. You still have to hold them accountable. They can change this. They did it. They can undo it.
Yeah, I love that. They did it. They can undo it. People, if it could be done and it was done disastrously, it can be undone, and it can be undone actually beautifully. Let's expand access to healthcare. Exactly. Let's not just go back to where we were. We're one of the only industrialized nations also that don't have universal healthcare. I can't believe that we, at this moment in history, in this country, where we have so many resources, are rolling back healthcare. That hurts our families. It hurts our economy. It hurts our country. It hurts our international competitiveness. There is nobody who wins except the person who is getting the tax break on their private yacht or their private plane. And hello, they do not need more tax breaks on their private yachts or planes. No, we need access to healthcare. Vaishu, if you were at a town hall, and we will be seeing, particularly in August, many members of Congress holding town halls, what would be the question that you would recommend that our members, our listeners, our audience ask their members of Congress when they're at home and they're holding these town halls, and you raise your hand? What should you ask?
If I were them, I would ask why they think working families don't deserve health care, because this is going to hurt a lot of hardworking people. And I would also ask them why they're lying about who they're taking away healthcare from. This is going to hurt seniors. This is going to hurt children. This is going to hurt people with disabilities. And they're lying to people, telling them that this is only going to affect 20-year-olds sitting at home on their couch getting free healthcare. Now, I'm in my late 20s. I don't know a single 20-year-old who's sitting at home not doing anything, just getting free healthcare. Everyone I know is hardworking or struggling with a serious mental health crisis or addiction or various things that they need healthcare to get better and go back to work. So I would ask them about this false narrative that they're creating and whether they think that's a fair assessment of the American people, because frankly, it's insulting. We know what an American work ethic is, and we know plenty of people on Medicaid who embody it. And we know that the majority of people on Medicaid are working. Those are the facts. So, and plenty of people more are only not working because they have a serious disability, because they have caregiving responsibilities, because they're a student. So I would ask them who they think does and doesn't deserve healthcare.
100%. And I think the whole framing of deserving just makes me mad, because there's nobody who doesn't deserve healthcare. Literally no single human avoids getting sick. That's just part of life. And so everybody needs to be able to get better. And it is, again, so upsetting that we're in this moment where instead of saying, hey, let's expand access to healthcare coverage like every other industrialized nation on the planet, actual Earth, has already done, we're saying, hello, please reverse the damage that you just did to our patchwork healthcare system that we had. So people who are listening, we had a patchwork healthcare system. We still have a patchwork healthcare system. Is that the end goal? No. The end goal is to have seamless, smooth access to healthcare for everyone. And so to have this rollback right now is so insulting. Joy, what's giving you hope and keeping you going?
Well, before I answer that, let me just also remind you that we've had work requirements, because that's what we're all talking about here. We've had work requirements in other states, and they have failed, right?
Yep.
So we already know. Just don't think that this is like an experiment. They already know what's going to happen. They already know that even though most people who are on Medicaid do work or have some reason why they are not, that would be excused, that a lot of people that work for whatever reason are going to have a difficult time complying with the administrative burden and requirement. They know that it will be administratively costly to put this on, and it actually costs more, than it saves in the wash, right? So
Yep.
we understand that. They know this. They know that what it's going to result is in many people falling off the rolls. So in case you're thinking, well, let's just try it and see. We've already tried it in Arkansas and Georgia. It doesn't work. Ask anyone from those states. Okay, what's keeping me hopeful? Look, what's keeping me hopeful is really all of us, right? It's the Mamas Rising Network, it's Protect Our Care, it's all of these things. I mean, this bill is so unpopular that I think it's going to cost them in the future, right? And I want to protect our tax statuses here. It's going to cost people in the future, and it's a horrible thing to say, but that's a silver lining. They have gotten so greedy to do this, to take away things from working people, middle class people, to give it to not even rich people. These people are billionaires, like just the ultra wealthy, just is so craven that I think it's waking a lot of people up, including people who supported the president for a range of reasons, which I'm not judging in this moment. I'm just saying this is not what you voted for. And I think a lot of those people are going to be awakened by it. Sometimes you need that, a jolt to the shock to the system to remind you, you know what, we got to course correct. So that is what I have to pray for. And I'm not just going to pray about it. I'm going to do something about it. I'm going to a town hall in August, and I hope you'll be there with me.
Yeah, go to town halls wherever you live.
Yeah.
Vaishu, what is giving you hope?
I think that exactly what Joy said. My favorite quote is from Mr. Rogers, and he said, in hard times, always look for the helpers. So it's really nice to be surrounded by helpers that protect our care, and also groups like Moms Rising, Families Over Billionaires, everyone else who's doing this hard work. So look for the helpers and also engage, because as Joy said, this bill is unpopular, but that's only when people know about it. There's still a lot of people who don't know what this bill does, and there's still a lot of politicians lying about what this bill does. So if you're listening to this podcast or you're following Protect Our Care on social media, please amplify everything that we're saying. Please talk to your friends and family about it. Don't assume that they know, because a lot of people still don't. This bill is so bad that you'd think it would speak for itself, but unfortunately, we really need to bring it to light and make sure people understand what's in it. It's not going to speak for itself. We're going to need to speak on it. So, that's it for me. Thank you so much for having us.
Our social media materials so that people can follow us and our website. And if you have not had a chance to look at our hospital watch, it is very frightening to see all those places in the country that have hospitals that are at risk.
Yeah, I mean, and hospitals at risk are happening in every community, you all. This bill is really bad. Betrayal of the American public, betrayal of the trust of the voters. It is awful. Thank you so much for being on. Everybody, follow Protect Our Care, support Protect Our Care, amplify Protect Our Care, get involved with Protect Our Care, and stay involved. Thank you so much for being on.
Thank you.
We're going to take a quick break, but stick around. Next up, we're talking about calling up justice, how to connect in your community, and how to make our nation better for everyone. Welcome back to Breaking Through with me, Kristen Ralph Finkbeiner, powered by Moms Rising. I'm really excited because we have a very wonderful guest with us right now, Claudia Alick, who's the executive producer of Calling Up Justice. Welcome. Yay.
It's so good to be here.
I'm so glad you're here. So to start, our listeners, our audience, the people want to know, what is Calling Up Justice? We want more of it. Where do we make that call?
Indeed. Well, you can always go to callingupjustice.com. That's our main headquarters because we are a transmedia cultural producing group that is an anti-genocide group. So we are using arts to save our lives. We're multiply marginalized. We've got a lot of trans members, a lot of disabled members, a lot of Black members. And since I belong to all of these categories, I love fighting for all of the justices that we care about. And did you know we're actively collaborating on a project right now?
Yes, I did. I'm really excited. So one of the things that we need, that all of us need, that the royal me, you, us, and everyone needs is more disability justice training. What is happening right now with ableism? What is happening right now with backlash from Donald Trump and Republicans in Congress who are stealing our tax dollars to defund Medicaid? What is happening that everyone should know about why we need specifically disability justice in this moment in history? And yes, we do need it.
Well, the project that we're collaborating on is this 60-hour vigil for Medicaid. Like literally at this moment when I'm interviewing with you, we've got folks on the National Mall telling the story of their lives to save their lives. And we created a digital space on GatherTown that helps to connect people who can't physically go all the way to Washington, D.C. or aren't going to be able to hang out in the Zoom. So we've got all these beautiful connective areas. You know, I've been working with a lot of clients lately, and it's interesting. People in the world want nice things for each other. That never changed. And they hire me, and it's complicated because they need me to help them figure out the right vocabularies for treating themselves right and treating their clients right. They want to figure out how they can do this in, frankly, a less deadly way, in a way that has less denial about the parts that hurt and harm people. But the current political and policy environment is increasingly hostile to explicit efforts that prioritize equity and justice for marginalized populations. Like there are recent federal directives that have redefined what words mean. They've suppressed acknowledgments of oppression. They've made literal advocacy language a risk factor. So I've been recommending to everyone that you got to keep your eye on the prize. You got to keep fighting for the core things that we care about, not getting confused about it. Accessibility is a necessity for functioning organizations, for functioning societies. We don't need to act confused about it. And it's not doing a thing that's for one specific population. It's doing a thing that's for all of us. It's why I name my practice as anti-genocidal. This is about saving all of our lives.
Completely. And we can see actual numbers about the harm that's happening right now when we see that 17 million people are about to lose their healthcare coverage. And when we look at Medicaid, 1 in 3 people with disabilities are covered by Medicaid, but also 40% of births, and also 60% of nursing home cares, and also most rural hospitals in America. So we see in this instance and in many instances that we all do better when we're all doing better, that undercutting any group, any people, any community actually undercuts us all. And so what should everybody know about how when we all do better, we will all do better, or when we each do better, we're all doing better in this moment of backlash? I mean, because we are in a huge moment of backlash. So I want people to get like fired up, hopeful, persistent, insistent.
Exactly. Well, here's the good news. They're coming at us so hard because we were winning. We were winning. We were doing an awesome job of making our lives better. And they had to lie. They had to say, your lives aren't good, actually. Your lives are bad. And they're bad because of all the marginalized people. So you should let us steal all your money. Because that's what it feels like to me is happening. When you redirect almost $1 trillion, I want to say that again, trill, T-R, trill, $1 trillion. That is an unimaginable amount of collective wealth that belongs to us, that we all saved up to make sure our babies would have formula, to make sure little children would get enough food when they were going to school so that they can think straight, to make sure pregnant mothers can grow the next generation of humans, to make sure disabled people like me can survive to do the things we want to do in the world, to make sure our elderly population doesn't just die. And I hope this doesn't sound too extreme, but I name this social murder. It's social murder. When you redirect the funds that are supposed to keep people alive to billionaires' pockets so they can just make more money and not keep people alive, and we know that it will have devastating long-term effects, I can't call it anything but genocidal. And can you be genocidal to the entire elderly population of the United States, to all the babies and the children? I feel like that's what's happening, but the American public doesn't want to stand for it. And I'm just so grateful that there are organizations like Moms Rising, that there are organizations like Dread, that there's all these folks coming together to collectively fight for our lives. And that's what we got to keep on doing it with joy, with happiness. We were having a good time at the vigil last night. The lady from the United Domestic Workers, oh, she had us on fire. She said, protect and defend. And so I had disabled people on a TikTok live stream inside our digital encampment gather town, and we were all just screaming, protect and defend. And when we can come together for these life-giving moments, I think that fuels us for the rest of the struggle.
I think so true. And one of the things is that none of us are alone. Right now, we have a relatively small group of really vocal Republican leaders who are taking away, as you said, our tax dollars, redirecting our tax dollars, not only to billionaires so that they can get even more tax breaks on their private jets. Hello. They do not need more tax breaks on their private jets, but also in a really devastating way, over $150 billion is going to terrify hardworking immigrant families, to do human rights abuses in an increased way, to put harm to people who are building good lives. And it is not okay to separate families. And we need to say, we do not want our taxpayer funds to be shifted from healthcare to cruelty. We need, for sure, a safe, objectively secure immigration policy. We don't need cruelty. We do not need healthcare cuts. And so it is really a moment in history where everybody's standing up against this relatively small, very vocal group of Republican leaders in Congress is important. Now, I'll tell you why I think it's small. Because when you do polls in red states, in blue states, in purple states, you see that people, no matter if they're Republican, Democrat, Independent, Libertarian, actually support access to healthcare coverage, actually support reproductive rights. Hello, we've seen that even on every ballot measure that's come up in all different kinds of states, actually support people's ability to build good lives. And so we have Republican leaders in Washington, D.C. out of step with their own constituents.
That's right.
So what can people do?
You know, I'm from Montana. I spent 10 years in Oregon. I know my rural community. I know my rural white community. I also got a lot of family in Tennessee and Florida, so I know my black rural community too. There is a mythology that anyone wants this. Nobody wants this except for a few really rich grifters that are just taking all this money to the bank. So what can we do? We can know our neighbors and we can talk to our neighbors. It's a lot harder to believe a lie that your neighbor is somehow against you when you know who they are. It's a lot harder to believe a lie about your immigrant neighbor when you actually go to church with them, when you actually collaborate with them in the office. So know your neighbors. People want you to be afraid of knowing the name of the person who lives across the street from you. Have the cell phone number of your neighbors. Be able to help each other out in emergency. Belong to something that is a small group of positive, collaborative community building. Have a book club. Have a game night. Have something that brings you together with people. But also, we got to get involved in the larger piece, and that's the politics of it. So you got to know who's your comptroller, who's on your city council. Did you know you can go to all those meetings? You can talk to those people. You can say, hey, I don't like how you're spending my money. I think the largest thing you can do is just be deeply aware that all this stuff is yours. Well, it's not yours. It's ours. It's all collectively ours. And there's a very small demographic of broligarchs that want to take all of our nice things and ruin them. And we got nice things. I like our education department. I like our health care. I like that we were a country that had immigrants coming in, because that's how I came to be here. My father's an immigrant and had me, and I make this country great. So let's stop trying to get rid of people like me. So make friends with your neighbors, get involved politically. And then I guess the last piece of advice I have is take care of yourself. This is a long distance run. This is a long-term project. So stay alive, drink water, make sure your neighbors are alive, take care of yourself, take care of your heart, and keep going.
Yes, keep going. This is a marathon, not a sprint, people. I love the advice to get to know your neighbors, take care of your neighbors, and vote in every election. Because when we have members of Congress that are out of step with their own constituents, we can change that. There is a powerful tool. We are more powerful than the people in Congress right now. And when they Republican leaders are so far out there, the pendulum has swung so far that we're in the land of ridiculous harm, we can change that. And so don't forget that, because there's also a lot of messaging right now like, your vote doesn't matter. Well, yes, it does. If you see a lot of voter suppression legislation coming through, which we are seeing, if you're seeing a lot of weirdness around voting, that is an indicator that your vote is powerful. And yes, we are seeing that. So make sure you vote in every election and make sure you share your story. So we have already seen, for example, with Senator Tillis, who's a Republican, who switched his vote. We had vigils, Medicaid vigils outside of all of his in-district offices in North Carolina. He heard the stories. He thought about his own family and reflected on his own healthcare story. And then he was brave and switched his vote. Now, that did not get us over the line to all the way get enough Republicans to win that battle, but we are winning some battles, and sometimes, often, that's due to stories. We only have about a minute and a half left. Can you share a little bit about the power of sharing what's happening in your life as a story with elected leaders?
Well, our national narrative right now is being led and controlled by large corporations, large billionaires controlling the narrative, controlling our communication spaces. You know, I go on the FYP of my TikTok and I hear people, but am I hearing the real voice? So right now, that 60-hour vigil, it's so powerful because it's being fueled by our narrative and our stories. If we can make the national narrative really tell the truth about what we really want as a nation, as a people, it will be impossible to justify what they're doing. So tell your story online, tell your story to your neighbor. So I say, have an uncomfortable conversation at the grocery store. Tell your story. Don't skip over it because it's going to make the moment uncomfortable. Make it undeniable that this needs to be a country where we take care of each other. Don't be ashamed of your story of needing Medicaid, of needing help. That's fine. That's nothing to be ashamed of. So tell your story. Tell your story. Tell your story about how these systems actually worked for you. Tell your story.
Thank you so much for being on. Thank you for all you do. And I want to remind people, when you're telling your story, you're also showing that people aren't alone, because I can guarantee you there is no one in the United States of America who has never gotten sick and never needed a doctor. And yet we're pulling away access to healthcare for millions of people. So share your story, stay involved, get involved, and don't give up. Thanks so much for being on. We're going to take a quick break, but stick around. Next up, we're going to talk about the legislative timeline in Washington, D.C., what doom is on the line, and how you can rise. We'll be back in a quick flash. Welcome back to Breaking Through with me, Kristen Ralph Finkbeiner, powered by Moms Rising. And we are also powered today by the National Women's Law Center and Amy Matsui, who is an expert in what is going on inside Washington, D.C. and taxation and more. Welcome, Amy.
Thank you so much for having me, Kristen.
I am so thrilled / sad that you're here. Okay, I'm going to tell you why I'm sad. You have bad news to share. People, even though I'm laughing, you can laugh or cry about the bad news, maybe both. People are just figuring out what was in Trump's, quote, big, beautiful bill, which I call the big betrayal bill, because what it really was a massive cost shift away from programs and resources that lift us all and allow us to build good lives into people who are already very wealthy. And I'm wondering if you could give us a summary overview of what's in the bill, because there has been a lot of chaos in the news lately trying to distract from what's in the bill. Donald Trump specifically trying to distract from what's in the bill. But when you actually look at the facts of what's in the bill, it's pretty bad. What's happening?
Yeah, I think if you take a 30,000-foot look at the reconciliation bill, this big bad betrayal, this big ugly bill, it really is pretty simple. Just as you were saying, the bill makes historically huge cuts to programs that help people afford their health care, that help them put food on the table, that help them with the cost of education. And it basically redirects those and siphons those off for billionaires and big corporations in the form of tax cuts. And on top of that, the administration's really cruel and harsh deportation and detention policies. So we know that 15 million people are going to lose their health care. It really means that people are going to get sicker. It's going to be harder for them to access health care, both preventative maintenance care, things that kind of help them routinely and help them from stopping getting sick. And they're going to put off things that could make them really sick or stop conditions from getting even worse. So we know that when people can't access health care, it impacts them, their kids' health, their employment, their education. It really hits them in all phases of their lives. And we all are going to experience that because it is not only big cuts to Medicaid, which helps cover births, it helps cover home care, it helps cover care for folks in nursing homes, but we've also are going to see prices increase for the cost of health care on the ACA exchanges. So it really is going to be a sea change across the country for health care. We also are going to see that programs like SNAP that help 42 million people put healthy food on the table every month are going to get cut. People are going to have less to be able to feed their families. And because these are two programs where the federal government and the states partner, the states are going to lose these huge federal sources of income, of resources. And because so many states have to balance their own budgets, they don't have the option of running up deficits the way the federal government does. They're going to cut. They're going to take away programs, or they're going to have to raise taxes. And we know from this most recent bill that one thing that policymakers don't want to do, even though it's the right thing to do, it's the equitable thing to do, it's the way to make sure that we all have what we need, is raising taxes. So we really have seen that this bill is going to have impacts on women and families for generations to come, taking it from the families that need it the most and giving it, just as you said, Kristen, to corporations and to billionaires who it's a drop in the bucket for them.
One of the things that I just want to underscore is what you said about the immigration policy that is in that bill, which is just devastatingly awful. And I want to underline that what just happened is that Trump and Republicans in Congress did extreme cuts to Medicaid, to SNAP, to education, and more, as you just heard Amy share, to pay specifically for over $150 billion of more separation of families, more human rights abuses, and more terrifying, hardworking immigrants, people who are essential to our care workforce, to our economy, and to our future. And as we see this happening, we know something, and that is that our nation absolutely needs a safe and orderly immigration process that balances compassion and security. And we absolutely don't need cuts to healthcare, and we don't need more cruelty. And what we got out of this bill was cuts to healthcare, cuts to SNAP, cuts to education, cuts to the programs that voters time and time again have said we want our taxpayers to go to, and more cruelty. And I just am so upset that that happened. And so as we're talking about being upset about what just happened, and as we're also talking about the fact that Donald Trump in particular has been doing lots of chaotic things to try to distract from what just happened, what's your advice for people who are listening and saying, wait, what? You know,
I mean,
what
it's
are we doing?
exactly what you were saying, Kristen. I think there's really an effort to flood the zone. So there are so many different things that are happening on the Hill that, congressional leaders, Republicans, and the president are hoping that we won't pay attention to, because they're trying to push forward so many harmful policies at once. They're changing agency rules to try and take programs like Head Start away from immigrant families that they've been able to access for over 30 years. They're trying to hide the fact that they're limiting due process for immigrants, that they're overstepping the bounds of constitutional protections. And it's really important for people to believe what they're seeing. If they're seeing something and it says, this does not feel like my community, this does not feel like the country that welcomes people who are trying to find a better life and contribute to our community and to our economy, that's because it doesn't. And that's why it's so important, I think, for people to keep signaling that they're paying attention and that this is not what they want, the direction they want our country to be going in. So I think it really is, it's hard because so much is happening. It's hard because there are so many things going on at once, but we know it when we see it. We know when this is not the direction we want our country to be going in. And we need to make sure that we're raising our voices and making that heard.
100%. And you're not alone when you're wanting to raise your voice. We've seen record attendance at marches, at Moms Rising. We have 4 times the action rate of this time last year. We're seeing so many people across all political parties actually rising up to say, we do not want a cruel country. We do not want to cut Medicaid. We do not want to cut education. What are you doing, actually, Republican leaders in Congress and Trump? And we need to, as Amy said, keep raising our voices, because A, we need to reverse what happened ultimately, and B, there are some more fights that we're going to have to fight in terms of the legislative process in Congress that are coming our way soon. Can you give us an idea of the other legislative vehicles that are coming up where we need to be paying attention?
Absolutely. So one that I'll mention is really kind of a fight between Congress and the president. So the administration has had a bill which has the really catchy title of rescission, where they basically tried to take back funding that Congress already approved for different programs and services. And unfortunately, Congress didn't stand up for its own power of the purse, and Republicans in Congress voted for the rescission package that just went through. The problem is, it's like, as soon as you let this happen, it emboldens the administration, and they're already talking about doing this again. So they're, for example, talking about taking back more funding for the IRS. And we know that when you do that, the IRS is not collecting revenue, especially from really wealthy tax cheats or companies that are trying to shell game and hide their revenues and profits. And they're also not helping ordinary people who are having trouble navigating the tax system. So that's just one example of, when you're cutting spending, you're really harming everyday people, and you're stopping the government from actually collecting the revenues that could be invested in all of us. So one thing we are watching is a rescission package just passed, and there's threats that more will happen. And then on top of that, Congress still has to go through its ordinary budget and appropriation cycle, because the government spending is going to run out on September 30th. And so in the House and in the Senate, they're going committee by committee and and working through different pieces of appropriations. They're not done. They don't have a lot of time left because they're about to go out on August recess. And here again, something that we're hearing from the administration is, well, we actually don't want this process to be bipartisan. We don't want it to be agreed to. We might do other things that just refuse to spend the money that Congress wanted to approve. So we're really watching for what's going to end up happening in the Congressional Appropriations Committees. We're watching as we edge up to that September 30 deadline. And just even if the Congress approves a bill and says, well, we'll just kind of hold off and have spending at the same level we did this year, that's actually a cut because they're not increasing for additional every year there's more disasters, there are more circumstances and changes on the ground, and the funding levels have to correspond to that. And if instead we're operating with the same level of funding that we were last year, but things have changed, then it really is a cut. So we're really watching the appropriations process really carefully at the same time that we're waiting for more rescissions, at the same time that we're waiting for the impacts of the reconciliation bill, that big ugly bill, to continue to unfold.
And what a lot of people don't realize is the impact of the big ugly bill, the reconciliation package that we started out talking about, isn't going to be felt for 2 years because they did kind of a delayed release of disaster. And I want to just share that with people that it's going to be a rolling disaster for a little while. That's the bad news. The good news, we have some time to turn around this rolling disaster, right? Not every part of this bill can be implemented immediately, which means that we, the people, can raise our voices, call our members of Congress, share our story, vote, and maybe vote in some different people who are not trying to undercut the policies and the programs that we as a nation, as people, have said we prioritize, just to give people who already have a lot of money more tax breaks on their private jets. Yes, no, we need healthcare, not private jets, tax breaks. Thank you very much. We have time to turn that around a little bit. So we need to keep pushing, keep sharing, not give up, and importantly, vote in elected leaders, particularly in Congress, who reflect and respect our contributions, our needs, and what our country can do to make sure everybody can build good lives. And I'm wondering what you think about that in terms of next steps.
Yeah, I think it's really important that, on the one hand, you can definitely look at this long-term unfolding at different times and at different points for the policies in this bill. It's both a risk and an opportunity. The risk is that people forget. So we need to keep connecting the dots and reminding people what's in the bill and why it's going to make a difference in everyday families' lives. But as you say, the opportunity is that it doesn't have to be this way. We can make different choices. So everything that we can do to slow things down, whether it's filing suit against different provisions or making changes in the composition of Congress so that maybe they could make different choices and stop the worst effects of this bill from even happening. Those are both things that having a delayed implementation definitely creates an opportunity for.
Yeah, for sure. So what's bringing you hope in these hard times? Briefly.
I think one of the things that's bringing me hope is exactly what you said before, Kristen, and that is the more people learned about the reconciliation bill, the less they liked it, and the more they heard about it and the less they liked it, the more they raised their voices. So I think people have kind of took the position that, they really wanted to make their voices heard. They wanted to have their views heard about the direction our country is going in. And I don't see that stopping anytime soon. So I'm really taking hope from the fact that people have a stake, obviously, in our country and the direction it's going. And they really, really, really want to make sure that they're being heard in this critical time.
Thank you so much. Thanks for being on. Thanks for all you do. Everybody join, support, and stay involved with the National Women's Law Center. Thank you so much.
Thank you, Kristen.
Well, that's it for our show today. Thanks so much for tuning in as we cover the top topics in our nation in a way that requires the most boring disclaimer in the history of the planet Earth. Here goes. Views expressed on this show are those of the individual speakers and should not be attributed to Moms Rising, to this station, or to any news or social media service that may disseminate a recording of this show to the public or to any segment of the public. Boom! We'll catch you next week.